Hi, my name's Emma Kennedy. I work for the Grenfell Health and Wellbeing Service. I look after the healthcare offer to the survivors and the bereaved. My message today is about the way in which healthcare used to work prior to the Grenfell tragedy and after the Grenfell tragedy. My background history is with community mental health services, and community mental health services usually deliver mental health services within communities. Quite often my experience of this offer was the disconnect between communities and the actual service gave rise to poor uptake in the service, but also poor uptake from other groups that we didn't understand. One of the things that I've learned through my Grenfell experience is how to engage with communities in a way that feels like as if it isn't about lip service, it isn't about tokenistic gestures. It's about how you can collaborate, how you can use the assets of the community to be able to build a service and design a service and deliver it to meet the needs of that community. One of the most moving aspects of my journey so far has been the coaching that I've received as a professional within the NHS from the community. It's been about how willing the community is in guiding the services that we've been delivering and designing, but also in being able to oversee its delivery and help us to engage with people that actually feel that the service doesn't meet their needs and is more prescriptive from an NHS perspective. I'd like to think just briefly with you about the last 3 years that I've experienced this service, and I want to say that it's been an absolute privilege to be on this learning curve. I feel like as if a practitioner who's got effectively 25 years left of her career, that it's definitely going to enhance my ability to be able to deliver really worthwhile care to other communities. I also feel that I have a responsibility to be able to share my learning around my collaborative work with other organisations, and I've already been in contact with other trusts. I'd like to say, I think, thank you to the community for teaching me how to respond wholly to people's needs. I'd like to say thank you for being patient, because we weren't always the easiest people to engage with as an organisation. And I'd like to say that I'd like to continue on this work in the next 2 to 3 years, promoting obviously recovery that meets people's own prescribed and described journey of recovery. I'd like to talk about the way forward within the learning that I've achieved so far, and how to influence other system change within other organisations, not only CNWL but within other trusts. I think part of this responsibility is to be able to share the system change that I think we have created a template for, and is mostly around collaborating with communities on the design of service and the implementation of services across the country.